Now, with obstructive sleep apnea is a condition that a lot of people do not know they have. That's because it is not like something that gives you chest pain or dizziness or any other symptoms. However, one of the symptoms that's quite characteristic of obstructive sleep apnea is excessive snoring at nighttime. You have episodes where you stop breathing, which can usually be a few seconds and usually noticed by your partner, or you might be taking shallow breaths during your night sleep. Also, you might feel very tired during the day, headaches, poor concentration, fatigue, brain fog. These are all the typical symptoms you would expect with obstructive sleep apnea. And as I mentioned, the most important symptom is excessive sleepiness during the day when you should otherwise be awake. And what are your risk factors for having obstructive sleep apnea? So, risk factors would usually be obesity. A lot of people gaining weight, and especially if you have excess weight around your neck, this can obstruct the airflow and lead to episodes where you stop breathing at nighttime. Also, as we get older, you notice that you start snoring more as opposed to when you were younger. So, age is another risk factor for obstructive sleep apnea. And being a man, men are more likely to have sleep apnea than women are. Well done, women. However, here is the bad news for women. Your chances of having sleep apnea increases after the menopause. Also, if there is a family history of sleep apnea, you can say my dad had it, my mom had it, then you're more likely to have sleep apnea. Then think about lifestyle factors. If someone who smokes, if you drink alcohol, if you do not exercise, then you're increasing your risk factors for having sleep apnea. Then if you have underlying medical conditions, stroke, high blood pressure, diabetes, asthma, heart failure, even depression could increase your risk of having sleep apnea. Sleep apnea is also common, especially in children who have large tonsils or adenoids, and usually the simple way to treat sleep apnea is usually surgery by removing the large adenoids and tonsils. You might also have facial abnormalities or sometimes you can have a large jaw known as micrognathia that can increase your chances of having sleep apnea. To note that you have sleep apnea, several tests can be done. As I mentioned, if you have a high BMI, so they would examine your BMI, they would examine your blood pressure, they would examine your neck circumference. And also there are other tests, there are validated tests that can be done to see if you're increased risk of having sleep apnea. And these are tests that I will do towards the end. One of the tests is called the Epworth Sleepiness scale, while the other test is called the stop bang. In terms of grading the severity of your sleep apnea, we use what we call the apnea hypopnea index, known as the AHI. The apnea is simply when you stop breathing, while the hypopnea refers to the shallow breaths you take while asleep. So we use the abbreviation AHI. This tells you the severity of your sleep apnea. So you've got minimal, mild, moderate, severe. If you have less than 5 events per hour, that's usually minimal. If you have 5 to 15, that's mild. If you have 15 to 30, that's moderate. And if you have greater than 30, that'll be classed as severe. As I mentioned, having sleep apnea can affect your ability to do safety critical work, whether it's working as a train driver, bus driver, because you're at increased risk of having accidents if you're falling asleep during the day. So treatment is very important, and we have to look at lifestyle as the first stop. So, losing weight, exercise, diet is very important to address the lifestyle changes. If you're someone who smokes, if you drink lots of alcohol, you live a sedentary lifestyle, these are the factors that you need to target to reduce your chances or improve your sleep. I mean, there are oral applications that can also help where basically some people find that the jaw, when they sleep, the jaw goes back and it actually crushes the airway, which affects your ability to have oxygen into your airways and interrupts your airflow. So there are special devices that helps to bring your jaw forward and allows you to breathe better at night. There are also nasal clips that some people wear, but it's debatable how effective these are. But the gold standard of treatment is what we call CPAP, which is continuous positive airway pressure. The CPAP device, as you know, has a mask. It draws in air from the room. It filters the air through a DOTS filter, and it gives you positive pressure, into your system. The only problem with CPAP that it can cause dry mouth, it can cause dry nose, it can affect your breathing at night, and sometimes it might be the way that the device is used. Maybe you've not put the mask on properly or you're using the wrong type of mask, and that's something you need to speak to your doctor about. Surgery would depend on the underlying cause of what's causing your sleep apnea. But the good thing about CPAP is that it allows you to monitor your sleeps at night to make sure you're having good sleeps. It allows your work to have that satisfaction that yes, you're being treated. And for example, if your AHI was 30, by applying the CPAP, your AHI can now become 5, and you can show those readings to your doctor or to your work for reassurance. So earlier on, I did not mention what BMI should be a concern. So if you have a BMI of over 35, that's the body mass index when you look at your height to your weight ratio. If your BMI is over 35 or 40, these are risk concerns. If your neck circumference for men especially is over 43 and for women over 41, these are concerns that you're increasing your risk factors for having sleep apnea. So now let's look at the tests that might tell you if you've got sleep apnea condition. So this test is called the Epworth Sleepiness Scale, as it tells you it's a useful tool to help diagnose obstructive sleep apnea, which is when you start feeling very sleepy during the day. So I'm just going to go through the questions to see if I've got obstructive sleep apnea. So it looks at the situation and what are my chances of falling asleep during the day. Sitting and reading, I will put never. I never fall asleep sleeping and reading. Watching TV, I will put slight. I do fall asleep sometimes watching TV. It depends on what I'm watching. Sitting in a public place, e.g. in a cinema or a meeting. In a meeting, never. As a passenger in a car for an hour without a break, I'll put slight. Lying down to rest during the day when possible, I'll put slight. Sitting and talking to someone, I'll put never. Sitting after eating a meal without having drunk alcohol, I'll put never. In a car or bus which has stopped in traffic for a few minutes, that is subjective. It depends on how tired I am after work, but I'll put never. So if I calculate my total, that gives me 3. And it tells me here that the results are 0 to 5 is a lower normal daytime sleepiness. So I'm normal because I got a score of 3. 6 to 10 will be normal daytime sleepiness. 11 to 12 will be mild. 13 to 15 will be moderate. 16 to 24 will be severe. So basically, anything over 15, you should be considering your doctor referring you for sleep studies to tell you if you've got sleep apnea. This is just a subjective test. It is not to diagnose sleep apnea. It's a subjective test to let you know that you might have sleep apnea. So when you do this test online, and you get a score of maybe 13 to 15, don't now start telling people I've got sleep apnea. You go to your doctor, and so your doctor can take further history, further examination, and refer you for sleep studies. Now let's look at the other tests. So this tends to be more or less subjective than the Epworth Sleepiness Scale, and it's called the Stop Bank Questionnaire Test. So let's look at the questions. Do you snore loudly? Let's say yes. I think I've been told I snore loudly. Do you often feel tired, fatigued, or sleepy during the daytime? I would say yes. I have been feeling like that of late. Has anyone observed you stop breathing? I would say no. No one has observed me stop breathing. Do you have high blood pressure? I would say no. I do not have high blood pressure. Then it looks at my BMI. Did you notice that the Epworth Sleepiness Scale did not look at my BMI? So it tells me BMI less than 35 or BMI greater than 35 kilogram per meter square. So I'll go for less than 35. My BMI is about 27 because I've done the calculation. Age less than 50. I mean, I do look less than 50, right? Neck circumference, my neck circumference is definitely less than 40. Look at that neck. That's not the neck of a greater than 40 centimeters. So my neck circumference is less than 40 centimeters. My gender is male, so I get +1 for just being a male. Again, I get 3 points in Stop Bank questionnaire. So what does it doesn't really tell me. Okay, so let me go to the next steps. It tells me I'm at risk for moderate to severe obstructive sleep apnea. It tells me my risks are high. So you can see the difference. When I did the Epworth Sleepiness Scale, there were not that many questions, but it told me that I'm normal. When I did a Stop Bank scale, it tells me that my risk is high. This is why it's best to do both tests because it gives you a combination of what's going on, as well as the measurement of your neck circumference, your BMI, your risk factors. The whole big picture has to be looked at. So let me click on next steps. So it tells me clinicians may opt to modify the care of patients who are at high risk for obstructive sleep apnea, reducing medication dose. Those are the sleeping medications. Consider extending monitoring. Okay, this is all hospital related stuff. So this is when I now go and speak to my doctor and say, Doctor, I've done the Stop Bank Sleepiness Scale. It tells me that I've got high risk of sleep apnea. Then the doctor might refers me for sleep studies. The sleep studies might show maybe a drop in oxygen levels while I'm asleep, or it might not show a drop in oxygen levels when I'm asleep, but it will calculate my AHI, which is the apnea hypopnea index. If it tells me my AHI is less than 5, then that's minimal. If it tells me it's 5 to 15, that's mild. If it tells me it's 15 to 30, moderate, more than 30 is severe. Usually anything above 15, you want to be treated. I hope you enjoyed this video. Please feel free to ask any questions.